I've been getting so many questions like through DMs and in person about what should I do about pain? Like, what about chiropractor? What about PT? What about massage? And what about the dogs? Don't be whining now. They would need attention too. But anyway, okay, so I want to talk to you about that. Like, what is the best approach for pain? What really is the best? So we're going to talk about the difference between those three. We're going to talk about why, if you've tried them, why they might not be working. And then I'm going to share with you what the best approach to pain management is, in my opinion. So first, I want to share a disclaimer. There are many reasons why you can be experiencing pain. Now, in general, there are three broad categories that I talk a lot about. That is one, physical tension, which we're going to talk about today. Second is inflammation, which can also actually create physical tension. Then there's also stress, which then can create inflammation and physical tension. So they're all related, but those are the three main categories, and I break all of those down deeper and deeper and deeper. So today I'm going to talk to you about the physical tension. So when we're talking about chiro, PT, and massage, we're really targeting the physical tension that is creating the pain. And in that physical tension, there's actually a lot of reasons too that you could be experiencing pain versus some sort of imbalance in the muscle, which is what we're mainly going to be talking about. Also carrying too much weight or misusing your body in certain ways, disusing. Also, there's lots of factors. So we could go on all day, but I promise I was going to keep this short. So we are going to hop right into the difference between chiropractor, PT, physical therapy, and honestly, we can kind of put personal training in there as well, because it has to do with exercise and strengthening the muscles. And then massage, body work. So for chiropractic work, that function, the value that you get from going to a chiropractor is working on the joint, right? Usually putting the joint back in place. Maybe it's not completely dislocated, but it gets shifted a little bit. Why does that happen? Well, that can happen because of a car accident. That can happen because of overuse of a certain muscle or some sort of imbalance in the muscle. So the chiropractor's job is to basically restore function in the joint. So when it comes to physical therapy, that is all about, and even again, personal training, all about strengthening the muscle. So you are there to, especially with PT, with physical therapy, they do very specific exercises, which you may find in the gym and you may find at yoga, because I certainly do. And those exercises are targeted towards specific muscles and specific muscle groups or specific areas to restore a balance between, say, front and back, left or right, or whatever. Because the truth is, we use like the front of our bodies way more than we do the back. You know, we're doing a lot of flexion versus extension in normal day-to-day activity, and a lot in workouts as well. So physical therapy helps to balance that out. Now, when it comes to massage, massage is specific work on the muscle that is designed to release restrictions, adhesions, tightness in the muscle to restore its natural length and to increase the mobility and flexibility as well. So they all have their place. And the truth is, they all really have value together. I mentioned this when I did my story earlier, that I think there's a lot of like controversy or competition even. Sometimes people think, well, what I do is the best. Like everyone has to get massage because like massage is best and massage is way better than chiro or PT, and it's not true. Then PT sometimes thinks, well, the PT and the exercise, this part is way more important than like doing this, because if you do this, then maybe you don't need that or whatever, you know? And the same thing chiropractors, which is like, no, it's definitely the joint. Like we're going to loosen up the muscle by working on the joint. And I'm going to tell you about a law in a second that there's a little truth to that. But the thing is, it's like if we all honestly work together, and us all as in the professions of these three categories actually worked together, we would actually have better results for the clients, for the patients, ultimately for you to feel better, because that's the whole point. So there is not one versus the other. They really have their value and they all work together. So I want to talk next about why it may not be working. Say you've tried chiro, say you've tried PT, say you've tried massage, and you think, oh, I tried it, it's not going to work. I'm going to tell you why it may not be working. So we'll start with chiropractor. The reason that your adjustments may not be working could be one of two reasons. One, either your muscles are just so dang stiff that they just do not hold the adjustment, or number two, you're not relaxing enough for them to actually do the adjustment. So I do tell people, like, if you cannot relax enough to let them adjust you, don't go, because it's just going to like not be effective, right? So you have to, like, I go see a chiropractor every month, and we specifically work on my neck. And now that I'm pregnant, we're also working on hips to keep things in line and stable. And so, like, when he puts his hands on, I have to just like lay back, I just like let myself go and just like fall into his hands. That way I can actually receive the adjustment. Because if you ever got hurt from a chiropractor, sure, like, yes, there are people in every single profession that may not be doing the right thing, right? But often what happens is that you're so tense while you're getting it that when they're adjusting it, your body, your muscles are rebounding again, and that can cause a lot of soreness and stiffness too. So that might be why chiropractor does not work for you. One reason why PT may not be working is something called neurologic inhibition. Neurologic inhibition is basically when your brain shuts down a muscle. So you're exercising it, you're working it, you're trying to strengthen it, but no matter what you do, it's not getting stronger. And your PT is like, what is wrong with you? Aren't you doing these exercises? You're like, I swear to God, I'm doing the exercises, but it's not working. I'm not getting any better. And this happens because it's perceived weakness, basically. So they think they're testing weakness. They're not testing neurologic inhibition. It's really hard to test. The way you really honestly test it is by doing manual manipulation on the area. And if you have strength after releasing the restriction, then that tells you it was neurologic inhibition. Like, I always talk to my clients, and I try to explain our bodies kind of like, or our brains, kind of like the union. So the brain is the union, and say it's your bicep or whatever muscle that is being, affected right now, that you're trying to build strength in. Maybe there's pain in there. They say you get tendonitis or whatever. Your brain says, oh, you, the body, have not been treating the bicep well. You're not giving them rest. You're not paying them enough. You're not treating them good enough. So I'm going to shut it down. I'm shutting it down. They're on strike. Now, when you start stretching, giving it what it needs, maybe taking better care of it, then I'll turn it back on, basically. It's honestly a protective mechanism. Our bodies are really freaking cool because they do a lot of stuff like that where they're trying to conserve energy, they're trying to protect you. And so this could happen in PT, where you're doing everything that they say to do, but it's not getting better because it's not true weakness. You have to release that restriction before you can actually build the strength, because that's what the whole point of physical therapy is, building the strength up and creating creating balance due to an imbalance. And that's why working out, seeing a personal trainer, or just going to a gym is so important, because you need to train all of the muscles in your body. Like, there's 603 muscles or something like that, which sounds crazy, but we need to work them all so we can stand upright and we can do all the things that we need to do. So anything outside of like anatomical position, which is like when you're standing up and your arms are out in front of you, which no one does, anything outside of that is going to create some sort of dysfunction. So, okay, moving on to massage. Why massage may not be working. The biggest reason that I see massage not working is because you don't do it enough. You don't do it enough. You cannot expect, I've had a pain for 10 years, I'm going to go get a massage and that's going to fix me. No. You're not going to lose 50 pounds by going to the gym one day or having one healthy meal. Not going to happen. Everything is cumulative. But I will say, if you get relief after having a massage, say that's maybe 10, 20, 30%. If you get some relief, then you know that you need to come back and you need to make it regular. And when you are initially having a problem or having pain, you do want to come in more often, just like a chiropractor visit, just like a PT visit. Sometimes it's a couple times a week, sometimes it's once a week. It just depends. Then as you start to feel better, you can lengthen that space between sessions, and ultimately it comes to maintenance. Maintenance of keeping everything kind of loose, limber, working out those, like I said, adhesions, restrictions. There's in your body, we're going to go over this. One of the next things I really want to talk about is stretching, because I get that a lot too. people say, oh, I really need to stretch. Like if I bring up something about massage, like, yeah, I really need to stretch. And actually stretching is a form of massage. It's a massage technique. But there is a reason to why stretching does not work or isn't as effective, and we're going to talk about that. But what I was going to say is that there are two fibers in your muscles, myosin, actin, and they work together and they interlock. So that's what makes it so strong. So like sometimes like the stretching isn't going to work enough. The extending or like strengthening one side isn't going to release the tension on the other side. It will help to balance out the strength. But if you are having these things where they're locked in, you can't do anything but like literally get in there unless you do like a 10-minute yin yoga pose, which actually does affect the deeper fibers because it takes like 60 to 90 seconds for those fibers to even be affected, including elastin and collagen, which are also make up the muscle. But anyway, I'm not going to worry about all the science of the muscle, but those are some reasons why chiro, PT, massage may not be working for you. Everything really needs time, especially if you've been dealing with it for a long time. Like the sooner that you go to address something, like if you get in a car accident, like go get it treated right away, even if you don't have a lot of pain, because you could actually have whiplash symptoms still 2 years later, and then even have like anxiety based on different like restrictions in your neck. I know it's crazy, but when you have an issue, deal with it right away. Don't let the pain just sit. Don't say, oh, I'll deal with it later, or say it's going to go away. Maybe it will go away, but that's not the actual issue went away. What happens is then your body starts compensating, then your hip hikes up, and then your back starts pulling. There's something else, and then months down the road, it started with a knee pain, but now your hip hurts, or vice versa. So take care of it right away. The sooner you take care of it, the less treatment you actually need, and then where you can just use certain things as preventative, like ideally a massage would be something you would get like every week. Same thing, probably chiropractor and exercise. Like physical therapy, like I said, I put physical therapy and personal training or just exercise together because it's trying to do the same thing. And with that, at first you're going to have to do maybe these specific exercises, but in general, you want to exercise your body. You're doing that multiple times a week. You don't have to go 5-6 days a week. Start where you are. Maybe even 3 weeks is enough, depending on your schedule. Like my personal schedule right now, it's 3 days of strength training, 1 day of yoga, and then maybe 2 days of cardio. Like it just kind of depends on the day and what I've got going on. I see a chiropractor once a month. When I first started, I went twice a week. PT, I keep like in my back pocket when it comes to the actual physical therapy, not the going to the gym. But because sometimes too, like repetitive use, we're sitting at the desk, our lifestyle habits are the same, or we're doing the same kind of workout constantly, you are going to have some imbalances, and it's really normal. It's really fine. But finding a schedule that works for you. So, which honestly leads me to the next point of like, what is the best approach? Like I said in the beginning, there are so many reasons why you may be experiencing pain outside of physical tension, but when we're going to focus on the physical tension and releasing that, the best approach is to really do a combination. Do a combination of them all. Get adjusted. See, is there some sort of dysfunction? Sometimes when you get a massage and you release the tension in the muscle, it could naturally pull the joint out. When you have, the same thing could happen when you're getting an adjustment. Maybe on the opposite side, maybe because the joint was pulled out this way, so the muscle on the other side is being stretched, then that could help with the muscle. There's actually a law called Hilton's law, and this states that when you treat the joint, you affect the muscle and the fascia. When you work on the muscle, you affect the joint and the fascia. When you affect the fascia or work on the fascia, you affect the muscle and the joint. It's all related. So it's not, again, one versus the other. It's really all of them have importance and have value. And when you work on them together as a whole, which is another like holistic approach, which is the best approach, because again, there's never one thing. We do want that one thing. Like I just want to stretch, and isn't that enough? I just want to just get a massage. Isn't that enough? I want to just see the chiropractor. Isn't that enough? I want to just exercise. Isn't that enough? It's like, no, it's not. But this is actually what I help people with. One of the parts, one of my roles as a holistic health coach, a certified health coach, totally focusing on pain management, stress management, inflammation, things like that, is to help you figure out like how do I fit all this in? You know, because it can seem kind of overwhelming that there's so many things that you have to do, but really the key is consistency, a little bit over time, and you will reap the results. Don't expect to be completely fixed after 10 years of knee pain after one session. You know what I'm saying? It may take a few months. May take a couple years. I don't really know. You never know about your body because there's other things that you can do. Which is another point to make, is that don't rely on any of these. Don't rely on chiropractor, PT, or massage therapist to heal you. Like, there are things that you can do lifestyle wise that can help, and ultimately you are responsible for your own self, right? And these are just people that can help you. And even with massage, it doesn't always have to be like you have to go get a massage. Like, you can do self massage. I help my clients with that a lot, and showing them small things that they can do in between their sessions, or just in general, because I work with clients who do not live local to me and don't actually see me, but I can share with them massage techniques that they can do on themselves. Like, it's our body, we're allowed to touch it. So anyway, the best approach is to honestly find some sort of balance between them all and give it time. Give it time to do its job, and don't expect to be healed instantly. So that's the best approach for physical tension. That's just one area. So I am going to talk about stretching next, and I've also been asked about trainings for nutrition and for stress, which, as I mentioned in the beginning, two other main huge categories that affect pain or inflammation, which a lot does have to do with nutrition, but also has to do with stress. Stress can actually create inflammation in your body, and also physical tension can create inflammation because it makes your body think there's something wrong when there's really not, and it's just tense. But anyway, so we're going to do trainings on nutrition and stress sometime in the next week or two. But next I do want to do stretching because we're not doing it right and I want to help you to do it right. And so anyway, if you have questions, let me know, like DM me or leave them in the comments after I post this. Thank you for hanging out with me. Thank you for letting me share this with you. I hope it's helpful, and I hope you now know the best approach to pain management. Like I said, leave me any questions, message me, and I will see you soon. Bye. Hopefully I can end this right this time. Here we go. Bye.